When a tooth is missing, a 3-unit bridge can be a good choice for replacing it. In a 3-unit bridge, an artificial tooth is connected on either side to crowns, which are placed on the neighboring teeth to hold the bridge in place. A 3-unit bridge can be made of gold, porcelain, or porcelain fused to metal. It's custom-made for you in a dental laboratory, so it may take 2 or more appointments to complete your bridge. On your first visit, we numb the area to make you comfortable. We may also use a rubber dam to protect your mouth while we work. We remove any decay and use the handpiece to shape the teeth that will support the bridge. Then, we'll take an impression of your teeth. The lab uses the impression to make a model of your mouth. They'll use the model to create a bridge that precisely fits your teeth and bite. In the meantime, we often place a temporary bridge. On your next visit, we remove the temporary and begin a series of steps to confirm the fit of your new bridge. When we're satisfied with the fit, we try in the final bridge, checking the fit and your bite. When everything looks good, we cement or bond the bridge in place. 3-unit bridges have several advantages. They replace teeth for biting and chewing, assist in clear speech, help prevent teeth from shifting, and the crowns can also serve as restorations for anchoring teeth that have damage or decay. When you need to replace a missing tooth, a 3-unit bridge can be a functional, good-looking solution.